Let us start today's session with a prayer by P. Sai Lakshmi Garu, teacher of Jeevana Yogasala. Ma'am, please welcome, ma'am.
सन्नो मित्रः संवरुणः सन्नो भवत्वर्यमा सन्नो इन्द्रो बृहस्पतिः सन्नो विष्णुरुक्रमः नमो ब्रह्मणे नमस्ते वायोः त्वमेव प्रत्यक्षं ब्रह्मास्मि त्वामेव प्रत्यक्षं ब्रह्म वदिष्यामि ऋतं वदिष्यामि सत्यं वदिष्यामि तन्मायवतु तद्वक्तारमवतु अवतु माम् अवतु वक्तारम् ॐ गुरुर्ब्रह्मा गुरुर्विष्णुः गुरुर्देवो महेश्वरः गुरुर्साक्षात् परब्रह्म तस्मै श्री गुरवे नमः। शांति शांति शांति। ओम तत्सत्। ओम नमः। ओम नमः।
Good evening, everybody. Myself, I'm Kiran Deepti, one of the team member of this Jeevana Yogasala team. Today's session is for pregnant ladies. And this session is organized by M.B. Prasanna Kumar Garu, AP co-convener in INO, and Lanka Satyanarayan Garu, founder of Jeevana Yogasala. This session is for pregnant ladies. In today's session, we are going to say a lot of knowledge on yoga for pregnant ladies. I repeat that this session is going to share your knowledge, but it should be done practice in the presence of professional trainers or doctors. I repeat it again. This session is going to share your knowledge, but the practice should be done in the presence of professional trainers or doctors. This webinar speakers are J.K. Swapna Garu, A. Yoganjali Garu, Suchita Joshi Garu, and Dr. Andal Bhaskar Garu. In the first session, we are going to teach you about pranayama, and this is going to be carried out by Swapna Garu. And her qualifications are M.Sc Yoga, PG, UGC-NET Yoga Qualified, PG Diploma Yoga, Director of Nayago School of Yoga, Examiner of Yoga Certified Board. I hand over this session to J.K. Swapna Garu to say about pranayama and make you all clear in this session. Thank you. Ma'am, please welcome, ma'am. J.K. Swapna Garu, please welcome, ma'am.
So I hope everybody everybody who have joined this session are pregnant ladies. Everybody, all the pregnant ladies, stay. You are sitting. If you are sitting on the chair or on the bed, wherever it is, try to sit comfortably. Only thing to remember is you need to keep your spine straight. So that is the main requirement. And the people who are in the third trimester, they might not be able to sit with this seated leg position, that is the Sukhasana. If that is difficult for you, you can take help of any blocks or any pillows which are near to you. You just grab any pillow or any support so that you can just keep just next to your thighs. You can just keep your legs on the blocks or on the just you have to rest your thighs on the blocks. That will be easy position. Those who are not able to sit in this way, those who are not able to sit in this position, they can just try to sit in this way. For some people, they can't even keep their seat down. What they can do is take support of any other pillow or any block. You can try to sit on the block. Okay, you can even sit in this way. Don't worry if you don't have any block. Take any pillow or any bed sheet, or some people, if you are having any yoga mat is also fine. You can just rest your seat on that one. So the main thing is you should be able to sit comfortably. So once you have decided your position to sit, so sit, right? Okay. Try to keep your spine straight. Lift your chest and sternum up. Try to keep your spine straight. Those who are not able to even keep their spine straight, they can just lean against the wall. Just lean against the wall and take care that your shoulder should be opened up outside. It should not come in this way. Your shoulder should be open. Your chest should be broad open. This is a comfortable position. You can keep your hands on your thighs. Those who are comfortable, they can keep their hands in chin mudra in this way. Your elbow should be towards your body, but should not go outside. Just keep your hands and elbows in this way, right? This is the starting position. So today our topic is pranayama. What are the breathing exercises a pregnant lady can perform? There are many kinds of breathing exercises. We will focus on few exercises today. Let's start with 3 times of Om chanting. So just close your hands, right? Just join your hands together in prayer mudra or Anjali mudra, Namaskara mudra. Take a deep breath very slowly. Take a deep breath. So while breathing out, chant Om. Om. Again, take a deep breath. Om. Take a deep breath. While exhaling, chant Om. Om. Slow your palms. Make them warm. Generate some heat. Keep those palms on your eyelids. Really. So first we are going to do deep breathing. This deep breathing is very beneficial during pregnancy. Usually this can be done in non-pregnancy period also. Why we are suggesting deep breathing to be done importantly in pregnancy period is that while the pregnancy is getting progressed, your uterus starts enlarging little. It starts growing slowly. As the pregnancy is progressing, your uterus starts growing size by size. So as the uterus is growing, it keeps pressure. It gives pressure on the lungs. So because of that, because the lungs are getting pressed, we are not able to breathe properly. The lady won't be able to breathe properly. So if the lady is not able to breathe properly, the baby, the fetus, it depends upon the mother's oxygen. The fetus depends upon the mother's blood, mother's nutrients, or whatever the food, whatever the prana shakti which you are taking from the oxygen, it is directly transferred to the fetus. So if the lady is not able to breathe properly, if the mother is not able to take enough oxygen, if there is no enough oxygen in the blood, the baby won't be able to have enough oxygen. That is the first reason we need to do pranayama regularly during pregnancy. And the second reason is, as the pregnancy is progressing from month by month, We should provide some space for the baby to grow and move. So as you are putting the pressure on the uterus, the lungs are getting pressed up. The rib cage is also slowly, it's not having enough space to expand. So while you are doing this pranayama practices, you are trying to give more space to your baby. So that's why regularly you need to practice pranayama. This is one other point. Moving to the next point, why specifically deep breathing, or why specifically pranayama should be performed? Pregnancy, for some people it is the first time, for some people they have second pregnancy or third pregnancy. So pregnancy is like a new kind of regime. Your body is going psychologically, physiologically, there are so many changes, and the mother goes through so many stages, and she might be having stress and anxiety. So to relieve the stress, to release the anxiety, to have calmness in the mind, to have stressful day, to free from stress, we need to do pranayama regularly. So let's go for deep breathing. So in deep breathing, what we need to do is, after keeping your hands in Chin Mudra or Anjali Mudra, you can see one round of demonstration and then you can perform. Keeping your spine straight, chin parallel to the ground. Try to take a slow and deep breath. As you are breathing, try to lift your sternum, try to open up your chest, try to raise your collarbones and your shoulders. So as you exhale, you need to pull your abdomen a little inside. Your chest would get contracted. Your collarbones would be sinking down. This is one full round of deep breathing. Going for the second round, slowly take a deep breath. As you inhale, feel the expansion in your abdomen. Feel the expansion in your chest region. Feel the raising of your collarbones and your shoulders. You need to lift your sternum because most part of the lungs are on the back side of your spine. We usually don't concentrate opening up our rib cage or diaphragm while we are breathing. So you need to, while you're breathing, try to lift your sternum, feel the opening of your chest. Your back side of the lungs should also get breathed properly. Once you finish your inhalation, very slowly exhale. Again, you need to observe while you are exhaling, pull your abdomen inside, contract your chest, lower down your shoulders, sinking your collarbones down. This is full cycle of deep breathing. Now we are going to do 7 cycles today. So sit properly, all the ladies. Keep your hands in Chin Mudra. Try to keep your spine straight. Close your eyes. Slowly settle down. Try to bring your conscious on your breathing. Just breath. Breath. You haven't started breathing. Just observe your breath. Your breath. Your natural. Start taking deep breath. So inhale. Inhale very slowly. As you inhale, up. That means you need to fill your abdomen as a balloon. Imagine your abdomen is a balloon. Your chest would start expanding. Feel the expansion. Just still start taking a deep, slow tension. Observe the bones are rising. Inhale up. Now slowly start taking. Pull your abdomen inside. Contract your chest. Lower collarbones down. This is one full cycle. We are Against our technique is chest. Exhale, pull your abdomen inside, contract your chest. Again, as you inhale, fill your abdomen, try to expand your chest. Very slowly by contracting your chest, lowering down your shoulders. Now continue the same for the next. Inhale, exhale, inhale, exhale. Slowly relax, come to your normal breath. Don't open your eyes. You are doing your natural breath. Be in sync your breath. Feel the internal silence. Observe the stability in your mind. Observe the calmness. Observe that silence. Just be in rhythm of your breath. Now slowly start observing breath in a rhythmatic manner. So while you inhale, mentally chant so. While you exhale, hum. This is known as Soham breathing or Soham meditation. So while you inhale, very slowly chant so. 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 It need not be very large sound. You need not chant loudly. It's okay even if you chant mentally. No need to open up your lips also. You can feel it mentally also. Just for the audience, I am pronouncing Soham. So. 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 So, slowly calm down. We'll move for the other technique. So this one is breathing technique with double the amount of exhalation. We need to inhale for 5 count and exhale for 10 count. It is also known as pursued lips breathing or ah breathing. So how do we need to do it? After closing your eyes, you need to take a deep breath by counting mentally for 5 seconds. Like as you inhale, count 1, 2, 3, 4, 5. So up to 5 count, you are going to inhale. After that, while you exhale, you need to exhale very slowly. That means you need to take a longer exhalation for 10 count. And while you're exhaling, what you can do is you can make your lips as if you're going to blow a balloon like this. Like the way how we are going to blow a balloon, in that way we need to exhale with our mouth. So let's do 5 cycles this one. So keep your hands in Chin Mudra. Like keep your spine straight. Don't collapse your shoulders down. Keep your spine and shoulders straight. Now start taking a deep breath. Up to 5 count. I will be counting 1, 2, 3, 4, 5. Now start exhaling for 10 count. Make your lips in O shape and start exhaling. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Second cycle. Take an inhale. 1, 2, 3, 4, 5. Exhale with your lips. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Inhale. Take a slow and deep inhale. 1, 2, 3, 4, 5. Exhale. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Fourth cycle. Inhale. 1, 2, 3, 4, 5. Exhale. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Inhale. 1, 2, 3, 4, 5. Exhale. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Slowly relax, relax. So this technique is very helpful during your labor. While you are getting contractions during the delivery, then if you have practiced this regularly, this would definitely help you to push your baby and to withstand the pressure, the pains which you are getting, the contractions which you are getting. You can use this technique. That means you are taking a slow inhalation, and while pushing the baby down, you are trying to count for 10. No need of any tension and any stress at that time. No need to worry whether the baby is going to come out or not. If you just start counting 1, 2, 3 up to 10 and give a big push. Again inhale and then give a push. So this will helpful for the labor and for the normal delivery. It will help you. So let's move to the next pranayama. The next pranayama is nothing but Bhramari pranayama. It is also known as humming deep breath. Most of you might have been here. For those people who haven't heard it, so in this Bhramari pranayama, what we are going to do is, this can be done Either using your hands or without your hands you can do. So there is one mudra associated with this. That mudra is known as Shanmukhi mudra. In this Shanmukhi mudra, we will use our thumbs to close our ears and the index fingers to close our eyes. The next finger to close our ear, to close just above our nostrils. Then lips, above lips and mouth. This is known as Shanmukhi mudra. Okay, Shanmukhi, closing all our senses. Actually, Shan means 7. 2 holes for your ears, 2 eyes, 2 nostrils and 1 mouth. Shanmukhi mudra. So those people who are not comfortable keep doing this mudra, you can just use your thumb or index finger to close your ears. Anyway, it's okay. As you start progressing in pranayama, you can use for Shanmukhi mudra. So those who are comfortable, they can keep their hands in Shanmukhi mudra. Those who are not even those who have not been practiced that, you can just simply close your eyes with these 4 fingers and thumbs closing your ears. And other thing is, even you can just close your ears like this. I have kept my microphone, so I'm not able to keep this. So just remember, you need to shut down this. Near your ear, there is one small like this. Just you have to close this one, right? Now, so this is the mudra we need to use. So the technique is, you need to take a deep inhalation for 5 count. As you exhale, you should close your lips, touch the tip of your tongue to the upper palate and chant Makara. Makara is nothing but the ending sound of Omkara. Om is there, no? So, so this sound should be produced. We will do 5 cycles. So, just close your ears. Those people who are comfortable, they can close their eyes also. Right. Now start taking a deep sound, deep inhalation. Start taking a deep inhale. As you finish your inhalation, start chanting Makara. Second cycle, take a deep inhale, very slow and deep inhale. As you finish your inhalation, touch the tip of your tongue to the upper palate. Start chanting Makara. Right. Go for third cycle very slowly. Take a deep inhale. Inhale very slowly. We'll go for fourth cycle. Take a deep inhale, inhale, inhale slowly, and start chanting Makara. Last cycle. Take an inhalation very slowly. Inhale. Now start chanting Makara. Don't open your eyes. Observe that frequency. Observe the vibrations of the Makara sound. If you are very keen in observing, you can feel that the center of your head, the talu, this is known as the talu in Sanskrit. So this place, Sahasra Chakra would be there. You can feel the vibrations there. The sound which you are producing is nothing but the humming bee sound. The bee starts. So, as you do this sound, as you are producing this sound while doing this pranayama, You are activating all the muscles and the nerves which are present in the central nervous system or which are present in the brain. So automatically, this would increase the neural activity which is present in your brain. It strengthens the psychoneuroimmunity system. It increases the autoimmunity in your system. By chanting Makara sound with the help of this Brahmari Pranayama, you can be always stress-free. Any sleeping disorders, anxiety, depression, all kinds of disorders would be relieved by this Brahmari Pranayama. And especially during pregnancy, the baby would start connecting to this sound when the mother is pronouncing. He will be able to bond up with her mother, or with his mother. The baby would start bonding with them. This is nothing but the nadam. Nadam of this should be very sweet and rhythmically sound. As you start doing practicing, your sound will start coming as a very smooth sound. So this is Brahmari Pranayama. You can do up to 5 to 10 rounds. Last pranayama which I am going to explain is this Nadi Shuddhi Pranayama, or also known as Nadi Shodhana Pranayama. Since we are not doing any kumbhaka in pregnancy, this is also known as Anuloma Viloma Pranayama. So the name of the pranayama is Nadi Shuddhi, also known as Nadi Shodhana. Since we are not doing kumbhaka, it is also known as Anuloma Viloma Pranayama. So how do we need to do this? So use your right hand. In your right hand, just close the next two fingers to thumb. That means index finger and the second finger we are closing. So this is known as Vishnu Mudra. You need to bring your hand like this near your nostrils. Left hand will be in Chin Mudra. Always the elbow should be pointing downwards. Elbow should be in this direction. Don't lift your elbow in this way. Those people who are not comfortable in bending their fingers, some people they can keep their fingers near the Agna Chakra also. That is also fine. No need to worry if you are not able to bend. So anything is fine. So after bringing your fingers in this way, just check your thumb should be used to close your right nostril. The other two fingers used to close your left nostril. Try to keep your spine straight, chin parallel to the ground. Don't move down or move up. Right. So in Anuloma Viloma Pranayama, what we need to do is now close your right nostril or right thumb very gently. Close your right nostril or right thumb. Use your left nostril to inhale. Inhale very slowly. Inhale. Now I have finished my inhalation. Now open your right nostril and exhale. The sound should be very clear. It should not be noisy. It should be very smooth. While you inhale or while you exhale, during inhalation and exhalation, there should not be any noise. The flow of your prana or the flow of your breath should be very smooth. So what you have done is you have inhaled with your left and exhaled with your right. Now inhale with your right. Close the right nostril. Open the left nostril. Exhale. This is one cycle of Anuloma Viloma or one cycle of Nadi Shuddhi. We will do 5 rounds today. And remember, while you inhale, you need to count up to 1 to 5 mentally. And while you exhale, count for 5. Right? We will do 5 cycles. Come to position. Left hand in Chin Mudra, right hand in Vishnu Mudra. Right. Now start inhaling with your left nostril. Inhale. 1, 2, 3, 4, 5. Close the left nostril. Open your right nostril and exhale. 1, 2, 3, 4, 5. Inhale with right. 1, 2, 3, 4, 5. Exhale with left. 1, 2, 3, 4, 5. Inhale with left. 1, 2, 3, 4, 5. Exhale with right. 1, 2, 3, 4, 5. Inhale with right. 1, 2, 3, 4, 5. Exhale with left. 1, 2, 3, 4, 5. Inhale with left. 1, 2, 3, 4, 5. Exhale with right. 1, 2, 3, 4, 5. Inhale with right. 1, 2, 3, 4, 5. Exhale with left. 1, 2, 3, 4, 5. Inhale with left. 1, 2, 3, 4, 5. Exhale with right. 1, 2, 3, 4, 5. Inhale with right. 1, 2, 3, 4, 5. Exhale with left. 1, 2, 3, 4, 5. Slowly relax. Relax. Bring your hands down. Observe your breath. Observe the calmness. And slowly rub your palms. Make them warm. Just keep on your eyelids and open up your eyes. Now stretch your legs gently. Stretch your legs in front of you. Keep your hands on your back. Slowly shake your legs. Shake your legs. Relax gently your legs. Your feet, just press your feet and open up. Just press your feet and open up. Right. Just gently bend your knee and slowly open up. Right. So these are the few breathing techniques which can be done during pranayama. There are many other techniques also. So today, whatever the pranayamas we have discussed or whatever the breathing exercises we have discussed, this can be done regularly from 5 to 15 cycles every day. You just some time for you exclusively for pranayama, 15 minutes. Then select either 3 to 4 pranayama techniques and just keep on practicing it. Don't forget to practice the deep breathing as well as the longer exhalation breathing technique. These are very useful for the normal delivery and also to calm down your breath, to calm down agitation in your body, to be stress free. Thanks a lot. Thanks for giving this opportunity. Any doubts, just let me know.
Thank you so much, ma'am, for a wonderful session.
Yeah, thank you. Doubts we can take later, I think.
Okay, ma'am. If anybody have
Okay.
any doubts, you can please comment in the chat box. Okay, we have 3 more topics to be completed in this session, and they are to be carried out by Swapna Yoganjali garu, Suchita garu, and Dr. Andal Bhaskar garu. And now the next topic is pregnancy and diet modification. And it is going to be carried out by Yoganjali garu, and her qualifications are Diploma in Yoga, Bachelor of Naturopathy in Yogic Science Daughter, Naturopathy and Yoga Consultant. I request Yoganjali garu to hand over this session and make you all clear in this. Thank you. Ma'am, please welcome ma'am. Ye Yoganjali garu to hand over this session.
Yes, good evening everybody. Good evening, ma'am. Slides are visible?
Yes, ma'am.
So this diet during pregnancy is a very vast topic actually, and many people might be practicing the diet from the first trimester with the guidance of your mother or previous pregnancies. So everybody knows or everybody knows what kind of diet to follow during the pregnancy. But some myths we have been known to follow, because many things and facts and myths are they mix together, and they don't know what to follow and what not to follow. How much calories of diet can be consumed by the pregnant women, because whatever the diet you are taking during the pregnancy, that is going to help you for the breastfeeding time also, that is lactation time also. So one thing everybody should understand is, whatever the diet you are taking or food you are taking, that should be like whatever your intake, it is for your body first of all, then only it goes to the baby. Okay. Basically, during the pregnant time, so all the women, we feel very hunger. The hunger is one of the most great things during the pregnancy time. So we feel very much eager to eat so much during the pregnancy time. So this should be very much considered, because uh, the doctors or any gynecologist or anybody who suggests you to practice any kind of diet chart or diet pattern, first of all we should know that how much weight you are, or how much weight, either you are underweight or you are moderate weight or you're overweight. So these should be first of all the measurement of each and everything, because your height and weight matters a lot in this during the pregnancy time, because that should be the first and foremost thing, because the next how much of a weight you increase during the pregnancy time, that is going to be either a boon for you or a disadvantage for you. You should make it as your advantage for yourself, because many people in the first pregnancy, many women will be very much scared because of pregnancy, because how much weight they should gain, because some doctors informs that how much weight should be gained, but some doesn't know how much weight should be gained. So they gain more than 25 kgs or 20 kgs, so 30 kgs also sometimes. So and that would lead to a growth of baby, developmental growth will be disturbed either, or your growth will be, your body weight or your fat will be disturbed after the lactation period. It will be difficult for you to reduce the body's fat after the pregnancy time. Okay. So whenever you so diet is one of the basic things you are going to follow, along with pranayama or yoga or anything else. Your first foremost thing is the diet. Okay, so first of all, in the diet, whatever you're seeing is should be first of all the weight and height, as I said earlier. Okay, because that is one of the main things everybody should know. That is body mass index. First of all, we have to calculate the height and weight to estimate how much body fat you have, because food, everybody, that's what starving in during the pregnancy, because the only period where the women are forced to gain weight is, that is during the pregnancy, because other times we keep our body fit, but during the pregnancy, the surrounding of a people or a mom or dad or anybody, aunties or anybody, they suggest us to increase our weight. Okay, that is because to bear the body is not only for you, that is for your baby also. Okay. So one more thing is also there, that is environmental and the financial. Some people who are financially low, people can't take the diet frequently. So during the pregnancy time, whatever is available, we can't take. We should be very much concerned about the food, whatever you're intaking. So because what are the food you are intaking, the nutrients are as the blood, it mixes and goes to the baby. Okay, so you should care about yourself also and the baby in the womb. Okay, so same thing is like how the animals, if they eat something which is toxic to their body, or when the animals are pregnant, so that will be transformed from the mother to the fetus. Okay, so same thing happens here also in human beings, in the women. Whatever that we eat is going to be transmitted to the fetus also inside your stomach. Okay. Okay, so one thing, main thing we have to avoid in this modern generation, the 21st century, many people would be under the alcohol consumption or smoking. So that is one of the main things should be avoided, because that would affect even the baby also, which is also called as fetal alcohol syndrome. Okay, it not only affects the physical level, it also affects the mental defects. Mental and physical defects are carried out during the pregnancy for the fetus. Okay, so that should be avoided. Okay, so whatever the pregnant women take during the first trimester or second trimester or third trimester till the 10th trimester, what are the food they are taking should be in the quantity of the food should be very much concerned actually, because people doesn't know how much quantity should be taken and what kind of food should be taken during the pregnancy time. So many, because people who are under poverty line or low poverty line, or because the food, whatever the quality of the food or the quantity of the food depends on the women, depends on the financial status of the home, because many people does not get even the one lunch or one breakfast or dinner during the pregnancy, because those kind of people are also there. So concerning about them, for them even ragi, ganji, or cereals, or very green leafy vegetables. So these are the things not usually casually available all around. Even the vegetables, boiled vegetables can be taken. Any vegetable which is boiled can be taken. Okay, so any fruits, but it should also be free from any kind of toxic substances like pesticides, so much of pesticides. And one more thing is, what are the fruits you take or what are the vegetables you take, the direct intake is better than cooked food, because most of the cooked food, there is a loss of nutrients so much. So you can go with direct eating of fruits and certain vegetables, not all vegetables. Certain vegetables can be taken in the raw form. Okay. So main thing, whatever is needed for the women's pregnancy time is basic nutrients, that is carbohydrates, protein, or vitamins, fat. So these were the most important things for the growth of the baby inside womb, for the fetus, and for even in this case during the pregnancy time, because of the insulin. There is a insulin deficiency, or I mean diabetes during the pregnancy time. That is also called as gestational diabetes, because blood glucose level is being low or high during the during the pregnancy time, because of the certain hormonal changes, and even hypertension during the pregnancy time, because of the intake of sodium, intake of lots of sodium. Yes, that's because the hypertension is caused. So this will be only during the pregnancy time, even the case of thyroid condition. So all this can be only avoided only if you are concerned about your diet. Okay, so how much weight gain can be recommended for a pregnancy women? Okay, so 11, that's what I said, 12 kgs to 15 kgs can be recommended. That is average weight gain in the pregnancy. Okay, So if the woman is at the risk of nutritional deficiency like anemia or any vitamin deficiency or protein deficiency or any folate, that folic acid deficiency. So these kind of deficiencies can cause the women from normal delivery to the cesarean delivery. Okay, so that is why the weight of the women is very much concerned during the pregnancy time. Okay? So approximately women should gain 0.4 kg per month during the first trimester. So first three trimesters, so people may gain only 0.4 kg. Then later in the last two trimester, that is from 9th and 10th trimester, they'll gain 0.4 trimester. But in the middle of that, like second trimester, third trimester, so in this period 2 kgs to 3 kgs they might be increasing. Okay, so women who are underweight coming into pregnancy should gain slightly more weight than an average woman. Like if the woman is normal weight, okay, so in the first trimester 0.4 kg, but women who is underweight should gain 0.5 kg per month or week. Okay, per week. So the obese women, so for the obese women who is advised to gain less than average. So normal people should gain 0.4 kg, underweight women should gain 0.5 kg, and obese women should gain 0.3 kg per week. Okay, so this should be the one of the main focus because during the pregnancy time every week they will be going for an weight checkup, and monthly once a health checkup or the health care is very much important. The doctor concern is very important. So women with multiple pregnancies to gain at least 1 lbs per week. Actually, it is advised because they'll be very weak after so many pregnancies. So weight gain will be higher for a multiple pregnancy than for a single pregnancy. So that is weight gain will be more for the multiple pregnancy time. Okay. So next is the nutritional requirements. What are the nutritional requirements, and then how much calories should be taken by each and every women. That's what I said, because we cannot calculate each and every time when we take food, we cannot calculate how many calories we are taking because many experienced mothers will be with the women. So along with that, you can just add up certain kinds of food, because you can concentrate like folic acid, then B complex vitamins food, because these foods folic acid can reduce the chance of having any birth defect. Any birth defect can be avoided by the food of folic acid. Okay, so they require childbearing age consumes 400 micrograms of folic acid every day. So folic acid is nothing but iron foods are called as folic acid. Okay, so pregnant women should consume 600 nutrients per day. So that's what I said. We cannot calculate each and every time we have the food. So we should know when we are before the pregnancy how much consumption of food you have taken, and during the pregnancy how much consumption you are taking, so that there will be the difference between the before pregnancy and the during pregnancy time. Okay, so what are the good sources of folic acid is green leafy vegetables, oranges, dried beans and peas, and fortified breads and cereals. So in the morning many people would feel the morning sickness will be there, and giddiness, vomiting sensation. So in this condition, so in the early morning times, you can go with instead of coffee, tea or milk, because the caffeine content will affect the excess of caffeine should be avoided during the pregnancy time. Not only caffeine, tea, Tea or milk should be avoided. Milk, you can take it, a very warm milk can be taken, but caffeine intake should be avoided even in the chocolate form. Okay. Next is calcium. So calcium intake during pregnancy and lactation period is also very important for the mother. So daily consumption of calcium during the pregnancy and breastfeeding time should be 100 mg per day. Okay. So if the breastfeeding woman is a teenager, then 1300 mg of calcium per day should be taken. Okay. Before conceiving, before the conceiving or before you become pregnant, the women should know about the consumption of folic acid and calcium supplementation with the physician, as well as the multivitamin supplementation. So, but avoid any kind of supplementation because the food, what I said last 2 days before also in the session, that food should be taken as the medicine. Medicine should not be taken as the food. This should be the whole mantra for you during the pregnancy time and your lactation period. Because the same thing, there is a difference between what the food you are taking normally and the supplementation. It might be the same when the physician discusses with you, but intake of the food directly, whatever the advantages is there, is more profitable and more advantage than the supplementation. So try to intake the food, not the medicine. Take it as a food. Take it as a in the form of pure vegetables or fruits or nuts or anything, but not in the form of supplementation. Okay. Okay, so protein. So coming to the protein. So protein needs increase when you are pregnant. There is a many myths going on that I'll discuss it later in the end. So because that protein would be the best thing for the body cells to grow for the fetus in your womb. Okay, but and not only the baby, but also the placenta. For the strength and the growth or the development, you need protein for your body. So extra 10 grams of protein above your extra daily calories. So that's what I said. So how much ever you are taking, take the food because pregnant women would feel so much of hunger during the normal days. So please take the food in the shorter food days, like you're taking shorter meals, I can say. So morning you're taking some 3 idlis or 4 idlis, then take it morning 8 o'clock, then go with again 11 o'clock, go with any green leafy vegetable soup or any boiled vegetables, then that would satisfy your hunger that time. Then next at 12:30 or before 1 o'clock, you can go with a bowl of white rice or red boiled rice. You can go with along with any fish, that is boiled fish or anything egg or any again go with a vegetables or curry or palya, anything it would be. Then again obviously 3:30 to 4 o'clock you will feel hunger. That time you can go with any kind of juice or any pomegranate fruits or any fruits which you are willing to have. You can go with 4 o'clock. Then again you will feel hunger at some 6:30. Then you can go with any other soup in the evening. Any soup you can go, but not very spicy soups you can take. Very sattvic food try to take during the pregnancy time. Okay, and try to avoid junk foods and processed foods or stored food or refined foods. So all this should be avoided during the pregnancy times. Okay. So the amount of protein you are taking should be about 70 grams of protein daily. You have to add up along with your diet. Okay, so compared with 60 grams for women who are not pregnant. So non-pregnant women can take 60 grams. So obviously pregnant women need a little more extra during the pregnancy time. Okay, so people who are vegetarian, okay, so people who are vegetarian can go with green leafy vegetables or broccoli. So then you can go with cereals. You can go with beans. All this will provide a good source of protein. But people who are non-vegetarian can go with ounce and a half serving of lean meat or fat-free milk. You can go, or 1.5 ounces of tuna canned in water. Okay, but do not have any canned food also. That is more very important. Canned, stored, or preserved food. So these are going to affect your baby fetus inside, not now, but in the future. Okay. Okay. So what kind of food protein requirements women do not need actually? So they should have plenty of lean meat, at least twice a week you can take, or thrice a week you can go with. Fish is one of the good source of omega-3 fatty acids and antioxidants during the pregnancy time, which is the best food I can advise. Okay, then tuna, eggs, and legumes. So these all which will sure meet your protein needs. So legumes, grain products, soya food. So these all in the case of vegetarians, people can go with vegetables, fruits, fat-free dairy products, and grains, legumes, and all. Okay. Okay. So whatever the food you are taking is better. What I told you now, 8 o'clock at what kind of food you can take, 11 o'clock what kind of food you can take. So what kind of food you can take in the morning, evening, afternoon, at night. At night, so while you're going to sleep also you might feel a bit of hunger. Okay, so that time you can go with mild and don't go with the milk at night. So I advise you to take apples. So apples would help you for satisfaction of your hunger. So go with either apple juice or pieces of apple. So that would help with for your hunger, okay, or any starvation during your pregnancy time. So in the morning you can go with bread, cereals, rice, and pasta. So this would be taking 6 to 7 or more servings daily. You can go with, and vegetable and fruit juice. So 5 or more servings daily. You can go milk, yogurt, and cheese fruit. So this would be 2 to 3 servings daily, and meat, poultry, fish, dried beans, eggs, nuts. So this would be 5 to 7 ounces daily, and unsaturated fat. So fat, don't think that fat is going to store lots and lots of weight in your body so that you become too much of fat. Don't think about that. See, fat is a good source of energy you're storing in your body, which is going to help in for the lactation period. So how much ever you're going to take it, so that is going to help you in the breastfeeding time. Okay. Okay. Then one more thing is fluids. So a lot of people go under dehydration during pregnancy. So in this case, I would tell people that keep a bottle full of water every time during your pregnancy, from the first trimester till the 10th trimester, or any premature baby birth, or anything, 7 months or 8 months, whatever it might be. But keep a bottle of water every time, wherever you go, wherever you come, you sit. Keep a bottle of water next to you. Okay, if it is a warm water, it's better to have with jeera in that. Okay. Okay, so daily you should have at least 8 to 12 cups daily. Okay, so because the excretion should be normal, there should be no constipation. The constipation is one of the major drawbacks in the pregnancy period. So constipation, if you have to avoid, you have to go with fiber containing food, and your water level should be higher than your consumption. Okay, so during the during pregnancy and before the pregnancy, what are the whatever the water consumption you are taking should be different. Okay. Okay, because the water is also from that nutrient nourishment is also passed to the baby through the placenta. So you have to keep your body hydrated. Do not make your body dehydrated. Okay. Okay. So one more thing is raw foods can increase your risk of bacterial infection. So like avoid anything outside from sushi and raw seafood or undercooked meat or poultry and beef, unpasteurized milk, poached eggs and raw eggs. So as I said, these are all not going to be happening if you are taking the home food. Okay, home food is the best food during the pregnancy. Try to avoid food from outside. Even though whatever, how much of a starvation you're going through, that still you're going to have something which is prepared from your home, not anything from the outside of the home. Okay. Okay, so what are the essential nutrients? I have to tell this. So folate, I have told, that is folic acid. Okay, so this should be taken 400 micrograms during the pregnancy. It was like whatever I tell also, still you will have that feeling of consuming certain foods during the pregnancy time. So if you want to still know about whatever food you are taking is whether correct or not, then you can go with the consultant with the doctors or physician, anybody. Okay. Okay, so this 400 micrograms can be taken in the 1 month before becoming pregnant and during the first 3 months of, that is first 3 trimesters of the pregnancy. Okay, the next is very much is calcium, because everyone knows, because it keeps the bones healthy and strong. So the next is omega-3 fatty acids, so which is very much important for the development of CNS, central nervous system, and the brain growth, high development for your fetus in your womb. Okay, so which is rich in oily fish like salmon, chicken eggs, and curry, sardines. So generally fish, whatever you feel like eating. And one more thing is of allergies. Certain kind of people have allergies with certain kinds of food like soya, peanut, fish, seafoods like prawns, crabs. So these kind of foods are the certain people have the allergies. So try to avoid those kinds of foods during the pregnancy. Okay. Okay. The next is iodine. So as I said, iodine, they should be controlled and balanced iodine in your body. Otherwise, which will lead to thyroid, hypothyroidism, which is going to even affect your baby cell. So iodine level also should be maintained. Okay. The next is zinc. So zinc is also going to help for your rapid cell growth for your fetus in your during the pregnancy. So it is also found in legumes, nuts, milk, whole grains, seafood, etc. The next is vitamin C. So vitamin C is a very important thing. For this, many people go with supplementation. So try to avoid supplementation of vitamins or anything, vitamins, and they go with B complex vitamins, tablets. So that's all. It's not going to help directly to your body. If it is very low, then the doctor would or physician would prescribe you with the supplementation. But by taking even supplementation also, try to go with the natural foods. So by taking natural foods, you can increase more than normal level of the certain deficiencies. Okay. Next is fiber. So to avoid any constipation during the pregnancy time, so that would be going to helpful for you, like whole grain bread, cereal products, legumes, nuts, vegetables, and fruit. Okay. Then as I said, yeah, water. So keep your body always hydrated by drinking 8 to 12 glasses of fluid. Okay. So what are the foods to avoid? So many people will be taking certain kinds of fish, whichever they like. Okay. So before anything, you have allergies or anything, you can avoid fish. Otherwise, you can go with any kind of fishes, at least twice a week in the week. Okay, so you can avoid prawns or smoked fish or any types of shellfish. Otherwise, you can go with normal fishes. The next is raw unseared fish. So the uncooked meat or uncooked fish or any raw food is going to affect your fetus directly, because this is not only you. You are going, the body inside your womb, there is a fetus growing in. So you're feeding the fetus also along with yourself. So you have to be very much careful while consuming anything raw in the non-veg form. Okay. The next is red meat and chicken. So generally, this is one of the heat-producing food, or I can say rajasic food in the form of yoga. They say rajasic and tamasic food. This is. So try to avoid during the pregnancy time. If it is cooked like a boiled chicken, then it is fine. But you're not going to consume anything fried or roasted. So this should be avoided. Okay. Okay, the next is jelly food. So many people doesn't know what is this. That nothing but this is which is served from the open containers or any processed or sliced meat, because this would affect the baby directly, leading to any infection or blood poisoning. Okay, so that is the that is going to be very much risky for you also and your fetus also. So try not to feed the baby with anything raw food or any processed food or any sliced meat. Okay. The next is fruits and vegetables. So before anything during the pregnancy, you're going to clean everything. Then you're going to feed yourself or your baby. Whatever you're taking, think that not only you're feeding for your baby also. So wash thoroughly before eating, and do not use that have gone moldy, that is which is destroyed a little bit also. So eat when be in a very cleanliness surrounding. Keep your surroundings very much clean and healthy. Okay. The next is soft serve ice cream. So many people would serve for the ice cream during the pregnancy time. So avoid this kind of ice creams or yogurts also, because of the bacterial infection which will be caused unknowingly to you. Okay. Okay. The next is eggs and mayonnaise. So raw eggs or raw eggs can contain salmonella. That is a kind of typhoid which is going to affect if you are eating it raw. So try to avoid anything raw during the pregnancy time. Okay, like sauces or this mayonnaise type. So everything in the raw form is going to affect you and your fetus also. Then, as I said, peanut, then that is one of going to cause an allergy. So allergic reaction can be caused for your womb. So it is a bit of dangerous to try to avoid peanuts also. Okay. And all over I can say is avoid eating out. That's all I can say, because the food, whatever you're eating outside, doesn't know that whether it is how it is prepared, how it is cleansed. If you are not pregnant, you are not worried about it. Okay, you are not going to worry. But when you are pregnant, they're going to serve your food for your fetus too. Okay, so you have to take care of yourself and your fetus also. So the next is food additives. Mainly, we will add Ajinomoto in your food and artificial sweeteners. So these all are also going to create an upset in your stomach and headache can be caused. So try to avoid Ajinomotos and artificial sweeteners which are using in the sweets and any kind of biryanis, and also try to avoid adding of these kind of Ajinomotos and artificial additives. Okay. Okay, then what we have discussed, then alcohol also, as I said before, it is going to affect your mental, babies, the fetus, mental and physical defects would be created. So try to avoid alcohol during the pregnancy time. Okay. Okay, next, as I said, caffeine, not only caffeine, tea, milk, chocolate. So this all should be avoided. Try to avoid during the pregnancy time, because it may also lead to miscarriage. There's a chance of miscarriage, birth defect. So it may reduce the growth of the baby. So first trimester you can avoid, you can find, but you can take once in a day if you're so much addicted to the coffee, but try to avoid it as much as possible. Okay. The next is common problems like hormonal changes that occur with menstruation, pregnancy, lactation, and menopause. I have discussed in the last women's hormonal issues. So women have the chance of getting iron deficiency, anemia, osteoporosis, cardiovascular diseases, type 2 diabetes, and some type of cancer. In addition, also many women will have the chances of getting premenstrual and menopausal symptoms. That is all because of the hormonal imbalances. But if your diet is proper amount of nutritional supply, if it is there to your body, you're not going to get all those. You can be very free from everything. Okay. Okay, the common problems what you're going to face, I'll just go through it. Anemia, then premenstrual syndrome and menopause, chronic diseases like osteoporosis, then eye diseases, nerve disease, kidney disease. So this is not going to be very much easy during the pregnancy, because everything, whatever you're doing to your body, it's going to affect your fetus also. Okay, so try to very much careful about your health and food, even water. Whatever you are doing yourself, it's all going to affect your fetus. Think about that, and the next step what you're doing will be always right. Okay. Okay. So with this, I'll end up this food beliefs. So many people have many myths in this era. Many people would be telling that you are eating for two. So we will also feel that, oh my God, yes, we are eating for two. We have to eat a lot. So many people would feel very much scared if it is the first pregnancy. If it's second pregnancy, it's fine. First pregnancy, when elders are around and when they speak about like this, then many people will be very much scared about it. So there is no problem. You eat as much as you want. Okay. So how much over you're going to gain, you're going to lose as much as after the breastfeeding. Okay. So when once the baby comes out and you start breastfeeding, all your energy is going to be sucked and taken to the baby as a breastfeed in the form of milk. It's going to be taken as the form of milk. So don't worry about how much over you are eating. Okay, so you can eat. It's not for the two. First you are eating for yourself, then only it's going to be taken to your fetus. Okay. Okay. The next is eat your low carbohydrate, not a high protein diet. Okay. So this is also one of the myths actually. So according to this, there is a food pyramid in which so everything should be taken in the equal amount. Okay, there should not be like a low carbohydrate and high protein diet, because carbohydrate and protein diet together is going to be working in your body, not in a separate manner. So like fruits, grains, vegetables, so milk, meat group, these are all going to be one kind of food. And the protein, so if it is only 2 to 3 servings of protein are required each day for non-pregnant women, but in the pregnant women, it's going to be 4 to 5 servings in the pregnant women in a day. Okay, so try to compare. Don't think about how much you are eating. Eat everything in the equal amount. But instead of white rice, so many people go with the white rice in the carbohydrate. Additional to that, you can go with red rice. That is brown rice, people say. So that has the and that has the efficiency and nutrients of what iron has. Okay, so that will be helpful instead of carbohydrate. It also has carbohydrate and iron nutrients. Okay, so you can go with instead of white rice, brown rice. So or if you don't like brown rice, you can go with white rice itself. Okay. Okay, the next is pregnancy-induced high blood pressure is caused by too much of salt. So this is another myth by the people talks. So the reality is that pregnancy-induced high blood pressure is due to many hormonal imbalances and physiological changes. What is happening in your body during the pregnancy? Okay, so before pregnancy and during pregnancy, whatever the hypertension is caused is completely different. Okay, so the processed foods or too much salt, whatever you are taking, it's going to be creating the it goes and mixes with the bloodstream and causes the high blood pressure. Okay, it can be reduced once if you reduce the quantity of salt when it is reduced, and try to intake as much as green leafy vegetables without salt added. Okay, so that would be helpful in the form of sodium content reduction. And many people would say because of high sodium edema. Okay, that is there is a two kinds of edema, that is water pitting, pitting edema, non-pitting edema. Okay, so this kind of edema in the swell, that is edema is nothing but swelling in the feet and swelling in the fingers, hands, fingers. Many would feel these changes during the pregnancy. That is nothing but it's all because of the the water storage. Because that is nothing but water storage, excess of water or excess of sodium. So this edema is caused. Okay, so try to avoid taking excess of salt intake. Okay. The next is next myth I can say is, now that you're pregnant, it's a good time to start thinking about folic acid. So as I said before, so before you're pregnant, 1 month before you're pregnant and the first trimester or your second trimester, you can have adequate folic acid. Okay, so you can take a multivitamin also before becoming pregnant, or you can go with adequate folic acid like green leafy vegetables and fish. You can go with cooked meat or not boiled meat. You can go with, because this is going to help with your baby's brain and spinal cord. Okay, so consumption of this vitamins and B complex vitamins, which is present in orange juice, beans, citrus fruits, dark green leafy vegetables, nuts, and whole grains, it's going to help you in the process of pregnancy. Okay, so before you're becoming pregnant, and if you're not pregnant, you are pregnant, folic acid is going to help you in all the way. Okay, not only if you're pregnant you can have folic acid, before that also you can have B complex vitamins. Okay. The next is, it is better to rely on vitamins rather than one's diet during pregnancy. This is one of the biggest myths, okay, because certain kinds of people follow certain diet pattern and suddenly they change to another pattern of diet, because the elders who are as neighbors or aunties, anybody would be prescribing certain kinds of diet. Okay, as they are very much experienced also, but they doesn't know what kind of body's condition you're going through. Only you know the body's condition, whatever is happening inside your body. Okay, so the best source of vitamins and minerals are found in the natural state itself. Okay, so the anything whatever you are having in the form of food, it's going to help you with all the nutrition supply. Okay, don't change the diet or don't rely on only particular diet like vitamin diet or any protein diet or any only carbohydrates. Don't rely on only one diet, one form of diet, because during the pregnancy time you will see lots of nutritional deficiency. So you have to go through with all the form of foods you are going to have, because if you are going to only one form of food, you will see the next side effects of nutritional deficiency. Okay, so all kind of food should be taken. The next is whole milk is more nutritious than skim milk. So as I said earlier itself, you can go with non-pasteurized milk. Okay, non-pasteurized milk should not be taken. Because calcium is more than present in the whole milk. So, but nowadays in this generation, like everything is when the cow itself is injected, and milk, whatever we are getting itself is on the form of very thick milk, and we doesn't know whether it's pasteurized milk or non-pasteurized milk. But try to go with very natural milk, like a coconut milk you can go with, or any soya milk you can go with. So that would help your body's condition than the normal. You can go with normal milk. I'm not telling not to go with, because certain people get allergic to coconut milk or soya milk. So it's better you can go with normal milk, but in the lesser amount. Okay, because we have the myth that milk is only source of calcium. Other doesn't have. Only milk can satisfy the needs of calcium. But I can say is milk is also a white poison, I can say. Okay, not only milk, all the like a white products like sugar, white sugar, and white and the milk and maida. So these are all should be the products you should avoid. But as a myth or as a fact, I couldn't say, but a myth it is the milk is considered as a more calcium present, which should be taken. But during pregnancy, you can't avoid taking milk, because the dietitian, the doctor or physician itself advises to take. But as per your wish, you can take. If you're not, if you don't have the habit of consuming milk, it's fine, no problem. You can satisfy the calcium levels with along with other fruits and vegetables. There is no any other issues. Okay. Okay. Then. The next is gaining less weight during pregnancy will make your delivery easier. This is one of the myths. So gaining less weight is going to not help delivery easier. It's going to make your delivery very tougher and very risky also. Okay, because the fetus inside your womb is it needs a nutritious level in the more amount to develop each and every part of the body for the baby. But if you're not giving enough of food in the proper nutritional amount, so then how the baby is going to satisfy all the growth and development of brain or anything, CNS or not, anything it might be, how it is going to achieve the certain kind of needs, baby needs, fetus needs. Okay, so at risk, it will lead really to the risk for severe complications like premature birth. If the baby is a premature birth, then there is a chances of lung and heart problems. So the women with a normal weight should gain about 25 to 35 lb during the pregnancy. Okay. Then, as I said before itself, you're underweight, little more, and if you're overweight, little less. Okay, so this should be the normal. Okay. Then at the last, with this, if you gain the right amount of weight during pregnancy, none of it will be fat gain. I said this also in the earlier. Whatever the fat you are taking, it is a good fat during the pregnancy. Okay. Sorry. The fat is one of the that's what I said, most efficient means of calorie burning. Okay, and your body is going to use this excess fat as an energy during labor and breastfeeding. There is going to be lots and lots of energy needed during your labor period. So that time you need really lots of fat, lots of energy producing nutritious food, whatever you have had from first trimester to till the 10th trimester or the 9th trimester. That is the one which is going to help you during your healthy labor, which is going to make your labor very much healthy and painless labor, which is very good. If your nutritional diet is very much proper, it would be the painless labor also, and your breastfeeding is also going to be very much easier because you have lots and lots of fat storage which is going to be used as the production of milk to your baby. Okay, so this is all a myth we are going to break down, and I think whatever the session was, I think it was very helpful session, and I would love to end the session with this. Thank you for everybody's cooperation. So if you have any doubts, you can ask me.
Thank you, ma'am. Thank you so much.